next order of business is a presentation by the Newtown Ambulance Squad. I believe Evan Resnikoff is going to do the presentation. Good evening, Evan.
Okay, there we are. All right, good evening. On behalf of the officers and the staff at Newtown Ambulance, I want to thank the Board of Supervisors for giving us a few minutes this evening to discuss our requests. As I think most people in the community know, Newtown Ambulance for the last 25 years ran what I think was, we all think is one of the best routine transport services on the side to help support the EMS division of the organization. And on February 1st of this year, we shut that down. It was a planned shutdown when we realized last summer that due to the attrition rate of EMS personnel, we weren't going to be able to staff it. The routine transport division helped subsidize the EMS division for the last 25 years. And we are at a point, as many other EMS organizations are in Bucks County, where we knew that division wasn't going to meet its obligations, so we had a planned shutdown of it. And as of February 1st, for the first time in 25 years, we became an EMS-only organization, responding to only emergency calls to the 911 system. We went from a staff of 86 to 49, and of the 49, 40 are currently active right now. And we are a small, tight-knit family, much like the police department is here in Newtown. As a preamble to this, I had sent the board along with a cover letter, our year-to-date expenditures along with our EMS budget. Now, since this was the first time in 25 years that we've had an EMS-only budget, everything that we budget for is basically on a projection basis because we really need the year to really see what this is going to look like. But after the first 6 months of the year, we have a pretty good picture of where we are. Our service revenue, which is the money that comes in from patients paying their co-pays and from our insurance company, is actually fairly on target right now. Our fund drive is under budget, and we had several other categories that were over budget, and I had put those variances in the cover letter as to why those are. One of the things in EMS organization, EMS has really evolved in Bucks County since 1999. We've become mostly career. But what did not change was our funding model. So when EMS was largely volunteer-based, it was okay to just rely on donations, on fund drives, on fundraisers, on insurance revenue. And now that we all have payrolls, like any other emergency service, we can't solely rely on reimbursements from the insurance companies. It's a very unstable model of revenue. Now, because we do have that revenue, we do not need to be 100% funded from a tax base like other emergency services. But bear in mind, EMS is in the Township Code, is defined as an essential service. Of course, they don't tell you how to fund it, but they say you have to have it. So we all have to collectively figure that out. So currently, for taxes, we are funded by a $500,000, which is the state maximum. And in Newtown Township, that gives us about $171,000 annually, which is about $21.80 per household on the average assessment of $400,000, or in tax terms, $43,600, I believe it is. So to think about that, that breaks down to about $1.81 a month for the average homeowner to pay for EMS service, and that, as you know, doesn't even pay for a half a gallon of gas these days. And you get a highly functional 24 hours a day, 7 day a week, 365 day a year EMS agency for $1.81 a month. Now, we've been able to function that way for many years, again, because we had a revenue from our transport service. We do fairly well with our subscription drive, and since I became chief in 2015, we've had over $800,000 in grants. We've done so well with that our entire fleet of 5 ambulances and my car that I drive is 100% grant funded. The entire fleet was not paid for out of our regular budget or capital since 2018. Many organizations get low interest penal loans, other ways to fund it. We've been very fortunate to not have to take any loans to purchase our fleet. But even given that, we refer to our budget, and again, these are unreconciled numbers because we haven't closed the books on June yet. We're currently at an unreconciled shortfall of $68,644 year to date. It sounds like a scary number. It's something to be concerned about. However, we know we still have other revenue coming in, such as the other portion of our tax revenue for this year, some other grants, but again, grants do not pay for payroll. Now, with respect to paying, whether we run 100 calls a year, 1,000 calls a year, or 10,000 calls a year, the hourly cost to staff the ambulance does not change. Our hourly cost in Newtown Township is the same as it would be in Ockamixon Township, as in Ben Salem Township. That cost to be at the ready 24 hours a day is not covered by our insurance reimbursement. We have to find ways, we use that money towards payroll, but when you think about it, the slow nights the guys have when they're not running calls, they still have to be here. We're expected by the community to be here 24 hours a day. Our EMS license requires us to be staffed at our highest level of licensure, which is advanced life support with paramedic, 24 hours a day. If we were to fall below 100% in service time, they could come take our license or put us on a provisional license. We've been very fortunate, again, in Newtown Township, that we have not had any out of service time this year. The services around us, which are St. Mary EMS, Pendle Middletown Emergency Squad, Yardley Makefield EMS, have all had outages where they've either downgraded a unit to BLS or they've only had one person and a responder in a car to cover their community. We've been fortunate because we have a dedicated staff, but that's only going to go so far. We need better support from tax revenue in order to maintain salaries at a level where we can retain the staff we have. We have been very fortunate that we have had very little turnover since we switched over to being an EMS only organization, but as you know, with the rate of inflation, that's only going to go so far. Our paramedics currently earn between $2 and $4 an hour less than their peers. Our EMTs are $8 to $10 an hour less than their peers. And looking at these other municipalities, they are supporting their EMS organizations at a much higher tax rate than we have here in Newtown Township. So therefore, for your consideration this evening, we are asking for the Board of Supervisors to support a referendum question on the November ballot to increase our tax millage from 0.5 to 1.0. Pennsylvania sets a limit of 0.5, and anything above that for EMS, which there is no limit to how high it could go, has to be on a November ballot, on a referendum, and the residents can choose whether or not to support an increase to 1 mil. What 1 mil means is an average of $43.60 a year per homeowner, or $3.63 a month if you escrow your taxes. It's an increase of $1.81 a month. And in comparison to other equally important partners of law enforcement and fire department, we're all essential services, all very important. This is a small amount of money to guarantee that you're going to have an ambulance at your door. And I can say, as president of the Chiefs Association, there are parts of the EMS system in this county that are failing to the point where people are waiting 15, 20 minutes for an ambulance in certain parts of the county, either during busier times or because there are services that are in areas that are not well supported by the municipalities and are not staffed. There have been some times in the county where it's so busy, even down here in Lower Bucks. We've responded to Morrisville Borough 3 times from our station this year. We've been to Newtown Borough once this year. And with our bariatric ambulance, we've been as far north as Bridgeton Township because the resource doesn't exist anywhere else. So we all provide mutual aid to each other. Our EMS system last year responded to over 62,000 EMS incidents in Bucks County, and this year's projections are looking at to be in excess of 65,000. Our call volume here is predicted to be about 2,400 this year, and we're on track for that. Depending on pandemic conditions, things that happen in the world, that number could even be more. And we respond and treat patients regardless of their ability to pay. Whether they have insurance or not have insurance, unlike a physician's office or another specialty care service, we don't pick and choose. Patients choose to call 911 because they need help, and we respond to help them whether or not they can pay for the service or not. So again, we are asking the Board of Supervisors to please consider and approve a referendum question for the November ballot to take our millage to 1 mil. This amount of tax, we are anticipating that this would support us for 4 to 6 years without having to come before the board for any other additional increases. And these are based on budget projections, call volume projections, and knowing what our fleet replacement plan is, and of course, retention raises for our staff. I'll be happy to entertain any questions.
Anyone have any questions? I do have one.
Sure.
If we were to consider and approve this resolution, and actually what we would be doing tonight would be authorizing the solicitor to write the resolution. What's the timing on that in order to get onto the November ballot?
So I did speak with the director of the Board of Elections. They would need to receive it by the beginning of September because they've got to test the ballots in September, and that's a pretty tight timeline. He advised the earlier the better. If they could get it end of August, it would be helpful to them to make sure that it gets on the ballot. They start testing the ballots, and then they have the extended window now because of all the mail-in ballots. They need a little bit more of a window than they had needed in previous years.
So if we would approve the writing of resolution and in August, then we would meet your timeline.
It would be tight, but if you get it to the county by the end of August, we'd be safe to get it on the ballot. Yes.
I'm not even sure a resolution is required. I'm waiting for authorization from this board to move forward with whatever the township would need to do to satisfy the Board of Elections requirements in order to get this on the ballot. If a resolution is required, it'll be back at your next meeting. If it's not, then if the board approves this tonight, I'm going to move forward and submit what I need to submit to the Board of Elections to get this question on the November ballot.
Okay, so and the wording that I have is generally draft language. So
yeah, and
that gives you the freedom.
That covers it. Yep.
Okay. Any other questions from the other board members?
I had a question. I was looking over some numbers from the townships that you service, and you do help out with Newtown Borough as well. And it just surprises me that their number is pretty low in terms of comparison to us. I mean, you mentioned that Newtown Township residents pay $1.81 per month. I don't know what that is for the borough, but I kind of calculated that we pay $8.75 per resident, let's say, and the borough pays $6.67. I just don't know how to calculate those numbers, but I just thought that was surprising.
So I met before Borough Council in October twice actually. Was their budget meeting in December, November, December, and then they reopened their budget in January. And if it wasn't for the mayor, we would have been defunded in December by the borough. The outgoing mayor was a tiebreaker. That was very disappointing because honestly, they cited a nonprofit website that I've never heard of, had a rating based on what's in our 990. And when I compared our score compared to our peer ambulance services, nobody participates that I know of. Because we are an emergency service, we're not necessarily a philanthropic organization, so we don't rate each other that way. But based on this website that no one heard of, half of the Borough Council was concerned about their donation, which isn't really a donation, honestly. They do collect an EMS millage of 0.25 mils, and we are requesting to go to 0.5. So they maintained at 0.25 mils, and I'm not finished with my discussions with Borough Council once I'm clear of what we're doing here in the township. I did tell the borough that I'd be reducing service come February 1st because we used to maintain 2 ambulances 24 hours a day, and we went to one ambulance at night, 2 during the day, except there's 2 nights of the week we do have 2 ambulances in service, but, and that has impacted response times, not so much with the township, because most of the time if we're running a call, it's in Newtown Township. It's if, you know, the borough calls, there was a resident that called me to complain, they waited 14 minutes for an ambulance to come, because we were on a call, and the ambulance that was responding was coming from Levittown, because that was the next available ambulance. So I was honest with them about that, and we held to our word, and we reduced the staffing based on the, you know, their support of the EMS service.
Okay, thanks. Glad to see you here. I actually missed your annual report, so maybe come the end of the year, you'll be back and give us some idea of the services that you provide.
Sure. Hopefully before the end of the year. We have better data collection this year, especially since the county's dispatch center went to a new dispatch system, which is giving us a lot better information by municipality. And we've got lots of good numbers, and it's really helped us predict this budget for this year and give us an idea where we need to be. So now I will say we're requesting this because it's solidifying our future, and it's helping us present day, and it's solidifying our future. We're certainly not hand to mouth. We're doing okay, but to maintain okay or better than okay, we need this. So for example, tomorrow we're starting a project. We're getting a new roof for $63,000. Major capital project. We can't avoid it. It's going to come out of our savings to do that. You know, so these are major things that, while our budget, you know, our predicted net was $152,000 this year, that didn't take into account we're taking money out of our savings to do capital improvements in the building. The building was built in 1991. One of the sections of the roof is original. The other was redone at some point in the last 20 years. And you know, these are costs we're going to start to have as our equipment ages.
And I did notice all those numbers in your budget, and your budget would continue to be open for review.
Absolutely, anytime. And I presented this is the same budget that I presented to the borough when I went before them in December. So all of the municipalities that we serve on a primary basis have seen our budget.
You are literally working on a shoestring budget.
It's very thin.
Yeah, I see that. Thank you for your services.
Thank you.
Evan, I just have a question in regards to like we know what a mill would raise township, when we raise a mill here, like $340 some odd thousand. What would a mill raise for you? Is it a different projection in regards to what you're collecting, as like different than what the township collects? And how is it broken down? What would the township be giving you? The borough? I think I saw Lower Mayfield, which was a pittance, or Upper Mayfield.
Upper Mayfield, yeah.
Which was a pittance, of which I was trying to decide what they do with the jointure. But do you have a breakdown? And if not, I understand. But do you have any?
How do you mean a breakdown?
Well, I mean, does a mill raise $340-some thousand, the same as it does for the township when we raise a mill?
It would be different by municipality based on the assessment of each house. So Upper Makefield, they issue payments to services that cover their area that are not same area EMS based on, I think, number of calls. So I think they have bad statistics, because we certainly ran more calls than the Garner check for $162. And I have to follow up with them, because the chief of their EMS service resigned a few weeks ago. They have an acting chief. They would have gotten the numbers from same area EMS. I have a good relationship with the administration of Upper Makefield, so I want to reach out to them to vet that, because $162 is like 2 tanks of fuel for us, diesel. So that's something we still have to follow up on. But yeah, each municipality has different assessments. So you know, I know in the borough, you know, a half mil is not going to be $171,000 like we have here. But I think that there needs to be a fair funding formula with that also. So looking at our run numbers and our costs for the township's concern, 1 mil will help us with what we need to do here. We're not finished with the other municipalities though.
And to be clear, right now, you're at 0.5, and you wanna add another 0.5 by virtue of the public approving it.
Correct. And we will do the work to work with the public and educate them over the next several months about what this means, and how it benefits us and how it benefits the service to the township.
A question for the solicitor. In regards to getting this placed on the ballot, there are no petitions that are required to be signed, is that correct?
That's correct.
Any other questions from the board? Open it up to questions from the public. Any questions from the public? Okay, seeing none, I'll call the question. All those in favor of authorizing,
I don't think we had a motion.
You know, it's been a month since I've done this.
I'll make the motion to,
Thank you, Mr.
for the
Calabro.
board to approve placing on the next November ballot a referendum for an increase for the EMS, or rescue squad, rather, should I say.
Okay,
I'd like to second that.
got a motion and a second. Now I can call the question. All those in favor of authorizing the solicitor to draft the language for the ballot referendum, say aye.
Aye.
Any opposed? Passes 4-0. So thank you. Mr. Sander, you have your marching orders.
Thank you, Mr. Chairman. Thank you, Board.